Cancer is now the leading cause of death in 22 states. That number has grown since 2000 when cancer was the leading cause of death in only 2 states. Neither Florida nor Georgia is included on this list, by the way. Joining me now is Dr. Scott Ackerman with Ackerman Cancer Center. Good morning to you. Thanks for being here. Appreciate it. Never good news to hear anything like this, without a doubt, particularly since cancer oftentimes ends someone's life, when heart disease is something you could usually, if you change some habits and whatnot, your eating habits, maybe quit smoking, you can reverse those effects. Right,
absolutely. We see that cancer now is the leading cause of death in a number of states. This new study came out from the CDC. And what they're looking at is the absolute numbers of people that die of cancer and the absolute numbers of people that die from heart disease. Still, in the United States, heart disease is the #1 cause of death. It accounts for just over 500,000 people every year, and cancer is just below that. But as advances are made in heart disease, great advances, cholesterol-lowering drugs, angioplasty, those sort of things, the number of people dying of heart disease is going down. The number of people dying of cancer has been slowly rising.
It's interesting, too, though, because, I mean, we, as a station, also are very actively involved in the heart walk and heart health. Do you think that a lot of this has to do with just awareness and education among the public when it comes particularly to heart disease?
Oh, absolutely. People are smoking significantly less than they were before, and smoking is directly related not just to cancers, but also related to heart disease, more so. And heart disease is one disease, and we have lots of cancer. So cancer incidents that are due to smoking, like lung cancer, has gone down, but we have other cancers as well. But in heart disease, when there's less smoking, there's less heart disease, and so we see a more dramatic decline in that. This is a good thing. It's a good thing for heart disease. There's even good news with cancer, where we were speaking about how more people are dying of cancer now than heart disease, but the truth is the rate of cancer death is actually going down. So the number of people per 100,000 dying of cancer is less. We're making advances in cancer, but the population is still growing, and cancer incidence is going up. And so although we're making advances in cancer treatment and able to save more lives with cancer treatment, the growth of the population, the growth of the incidence of cancer is still exceeding that.
Yeah, it's interesting, too, because part of this also compared to like the 1950s as an example, where you had very little cancer. Makes you wonder, and you ask these questions, is this something in the environment as we're seeing the rate of cancer and different types of cancers grows?
Well, in the 50s, the death rates due to heart disease was double that of cancer. Now they're together. There's a few factors. So people are living longer now than they were in the 50s. Cancer incidence goes up with age because our body, as we get older, we lack the ability in our body to identify cells that have mutated. So cancer incidence for breast cancer, lung cancer, most cancers goes up with age. So as people are living longer, we're seeing more cancer. And also because the death rates due to heart disease is going down, this is making people, which is a good thing, live longer, right, and live longer to get cancer.
Thank you very much, Dr. Ackerman, for your insight. Do appreciate it. If you missed any of this interview, by the way, you can watch it online at newsforjax.com. Just look under the morning show page. It'll be posted later this morning. Bruce?
Following a local break.